Orem Utah, about a very common ailment that affects a great number of people in this country, and that's chronic fatigue. Of course, the mainstream medical system is totally baffled by this disease. Reading from a posting of Mayo's Clinic on the web, I quote from them, "Of all chronic illnesses, chronic fatigue is one of the most mysterious. Unlike definite infections, it has no clear cause," end quote. This is from a so-called top medical institute in the United States. Our failed medical system that we call modern medicine in this country has little interest in preventing or reversing any illness unless there is a profit motive associated with the treatment. Alternative physicians and independent medical researchers have made great advancements in the understanding and treatment of this disorder. Tonight we are going to explore the subject with Dr. Chambers. Dr. Chambers, welcome, and we'll start off by asking you a couple of questions. When you see a patient that complains about chronic fatigue, what shows up underneath a microscope when you look at a live blood sample from them?
Yes, Peter, I think we have to go through a winnowing process when anyone has been previously diagnosed with chronic fatigue or fibromyalgia to determine exactly what might be causing the so-called unknown etiology of chronic fatigue. They don't really know what causes it, but often there is a cause, we just haven't gone into it far enough. As you ask the question, what shows up on the microscope, one of the first things I look at is to see if a person might not be digesting fats or proteins effectively, and red blood cells under the microscope get in a condition called rouleau. It's sticky blood, sludge blood, where the red blood cells are coated with protein or fat, and they stick on top of each other, and as they do, as most people know, the red blood cells have to be completely and totally separated to circulate appropriately to deliver oxygen, to deliver nutrients, pull carbon dioxide and waste products out of the system, and even deliver hormones appropriately. So on the screen, I have some blood right now, some live blood, and you will notice how the red blood cells are chained up on here. Every single red blood cell on there is in clumps or lines or chains, and that is poor digestion. It's very difficult perhaps for the camera to pick it up, but there is even food value, and this particular person has not even eaten any food for a period of 8 hours, and the food value is still digesting in this person's system and floating around through the plasma. And if that poor digestion persists, unfortunately, it just bogs down the immune system because immunities start to attack the food values, causing allergies. And right now, with the red blood cells sticking together, it can lead to lethargy and tiredness.
That's great. And generally, what do you find what's the diet of the most people that you've interview that have chronic fatigue?
This person that is actually showing this blood here is one that has not really received a good education in eating properly, and in receiving instructions of what to eat properly, we're trying to get them to eat less cooked, frozen, canned, boxed, or packaged foods, processed foods. We were designed to assimilate and digest more effectively live, raw, whole foods, but the shift in our sensory preferences have gone to eating more things that are enzyme dead, and enzymes are alive in most foods when they are still less than 120 degrees in their cooking or steaming, if they have not been previously frozen. All canned food, of course, is enzyme dead, and of course processed and packaged foods are enzyme dead. The pancreas is taxed in that case by having to secrete more of your own metabolic enzymes, and by the pancreas secreting the metabolic enzymes, it's like taking money out of the bank constantly. If you don't replenish it, it can start waning in the amount of your own pancreatic enzymes, and therefore we have the need to either use enzymes that are supplemental, or use foods that are more live and raw in our diets.
Can you talk a little bit about parasites and chronic fatigue?
Peter, parasites in the blood are readily seen when a person has been having their pets a little close to them, sleeping on pillows, drinking bad water, some parasites appear in food, or even having a weakened immune system. There is a parasite that's seen here in the plasma, and it's kind of wiggling. If the camera can pick it up, it's right here. And right now that particular parasite is feeding off of some yeast and fungus, which is commonly called candida, and that is the formation from eating too many foods in a refined carbohydrate category. Refined carbohydrates, of course, seems like in our societies today, our staple foods center around bread, pasta, rice, potatoes, cereal, pancakes, waffles, tortillas, bagels, muffins, and biscuits, to say nothing about pie, cake, ice cream, cookies, pop, and candy. Unfortunately, those foods are non-required, non-essential in human physiology. We eat them because we like them, and then as we eat them, they turn into these fungal formations, and these little circles are yeast buds, and by true medical definition, an overgrowth of yeast is called candida or candidiasis. Now, by the way, the reason I'm saying this is because that is the food source for parasites to live in the system, and this is a parasite that is right here, and there's also, I noticed one down here, and they're kind of wiggling, meaning it's a living item in the body that is parasitic and feeding off of this person's blood. When your immune system has to turn on these items to fight off parasites that you basically are feeding and creating yourself, then it weakens the immune system. It gives us what's called fog brain, tiredness, lethargy, and all it is doing is weakening our immune system, where the immune system should be there ready to fight other bacteria and viruses instead of working against the very foods that we're eating. I might also mention that whenever a person is lacking in vitamin B12, it's one of the first things that we look for in live blood to see that there's a uniformity of the membranes of red blood cells. Because if a person is lacking vitamin B12, often there will be large and small red blood cells in a page, and the larger and smaller red blood cells are indicative of having a B12 shortage, which can, of course, lead to pernicious anemia. Vitamin B12 and folic acid go hand in hand to help a person feel better. So in this winnowing process that I mentioned in the very beginning, we have to make sure that the person has their basic low-level vitamins. Number two, one of the reasons why I always carry a centrifuge with me with microcapillary tubes is to check to see in a microcapillary tube, after it has been centrifuged, when the red blood cells are separated from the plasma, that there is a good percentage of the red blood cells still formed. If a person is iron anemic, their hematocrit will be low. So hematocrit, in determining this so-called chronic fatigue and fibromyalgia, is very, very important to see if their iron is low, and if that is okay, step number two, then in looking at the blood, we see if the red blood cells are all the same size, or if the circumferences of them are large and small. While I'm in this blood, by coincidence,